Okay, well, let's get going. So, hello, everybody. I'm glad you're here today. My name is Allison Foster. I'm the Executive Secretary for Delta Mega. So, this year we are having a webinar series on professional development topics, and I'm really excited that today we've got a great lineup for you. We're going to hear from faculty and students at Fairfield University on navigating your public health career essential skills and knowledge for early professionals. So I am very pleased to introduce you to the panelists. I'm going to introduce Jennifer Schindler-Ruwisch, sorry about your name, who's Associate Professor at Fairfield University. So Jennifer, why don't you take it away?
Great, thank you so much, Allison. So I'm going to just share my screen here, and then we'll go ahead and get started. All right, so can everyone see the slides now? Looks good? Okay, thank you. So thank you so much for joining us today. Like Allison said, I'm Jen Ruwisch, and I'm here presenting with some of my colleagues, former students, alum. So they'll introduce themselves as they present their slides, but I am so grateful to be here co-presenting with Peyton Matthews, Georgi Kuparadze, and Philomena Apia. And today we're presenting on behalf of Fairfield University's Epsilon Omega chapter, navigating your public health career, essential skills and knowledge for early professionals. So today we're presenting on behalf of Fairfield and Delta Omega, and what we're presenting to you is what we're calling informally this public health toolkit. And so the public health toolkit includes a variety of resources on networking, online training, advocacy and community opportunities, and some recommendations. And the last slide that we'll have for you all is an appendix of a lot of the resources that we incorporate within our presentation so that you can take that toolkit with you and use it as you learn and grow and forward yourself in the field. So we basically wanted to kick off by saying that you have the skills. You wouldn't be here if you didn't, and now it's about showcasing them. So today, our goal is to share a bit more about how to gain additional applicable skills if needed to further your career, but also how to present your existing skills in a way that would attract new opportunities and employers. Excuse me. Okay, so we're going to do a poll, hopefully at the end of the presentation, to see where you are in this timeline. But generally, either you're in your educational phase or continuing your education at this time. You may be beyond this, where you're starting to network, present, and share your skills. We're not going to be talking about CV or resume building too much today, but there's a future webinar on that coming up in October if you're interested. And then there's this finding your foot in the door, whether it's your first role, your fellowship, your one-year role, and where that might lead you to further yourself into the field, into your next step in your future goals and your aspirations for your career. So now I'm going to pass it over to Georgi, who's going to talk to us a little bit more about networking. Take it away, Georgi.
Hi, everyone. My name is Georgi. I'm a graduate of Fairfield University's undergraduate program in public health and currently pursuing my master's in healthcare management. So let's start with the question, why should you network? Networking isn't just about collecting contacts. It's about building meaningful connections that can help guide your personal and professional journey. You can learn from others who walked a similar career path. You can get help with developing your professional profile, especially on platforms like LinkedIn. It's also a chance to advertise your work and your goals. Think of it as sharing your story with people who may open doors for you. Networking helps you understand industries or fields you're not familiar with, expanding your perspectives. You can make connections with potential employers, which is always a plus. And finally, it makes you feel a part of a broader community and just a nice reminder that you're not doing this alone. There are also three types of networking: operational, personal, and strategic. Operational networking involves internal contacts within an organization. It exists to enhance a group's functionality and efficiency to complete tasks. Personal networking consists of contacts from external locations, exists for professional and personal development, as well as to provide access to useful contacts. And lastly, strategic networking, which we're going to focus on today, is about cultivating relationships with people who can help you gain new insights, ideas, and opportunities that you might not have access to otherwise. So now that we've covered why you should network, let's talk about how to do it effectively. So let's start with the do's of networking, shown in the green on the left side. Just set SMART goals before the event, know what you want to achieve, and have a realistic timeline. Keep it professional, be prepared, and most importantly, be concise in how you introduce yourselves or ask questions. Always follow up with people you meet, whether it's a thank you message or a LinkedIn connection. And in the middle here, just a reminder that be yourself. Networking doesn't mean you have to be someone you're not. Listen actively, ask thoughtful questions, and if you can, go with a friend to help ease the nerves. And now onto the don'ts of networking in red. Just avoid handing out your resume. Networking is about conversation, not transaction. You would hand out your resume at a career fair or other types of event, but usually your career services will help you understand what type of documents you would need to be successful in any type of setting. Don't focus on quantity over quality. It's better to have few genuine conversations than dozens of shallow ones. Don't interrupt or talk over others. This can happen sometimes when people are excited and they want to share ideas. It might not happen consciously, but just be aware it can create a bad impression unintentionally. Also, try not to feel intimidated. Everyone is there to connect, just like you are. And finally, don't neglect to follow up. That's where real relationships start, actually. So you will have various opportunities to network. In-person networking opportunities usually can be more memorable for both parties. It can give you an opportunity to add some personality to your professional achievements and make sure you have a strong elevator pitch for any type of networking interaction. And some of the options include conferences, leveraging alumni resources, or university career center. Whereas online networking can be more comfortable for introverts and allows for a less stressful environment compared to the chaos of in-person events. And some options include LinkedIn and different professional groups on LinkedIn, like Public Health Connections Lounge, informational interviews that you can set up with people you're interested in. Make sure you understand the type of organizations you want to work for. You can look them up on LinkedIn and then search people based on their roles. And I always do that too, like just shoot them a message of who you are, what you want to do in the future. Most of the times you might not get a response, but other times you will. So make sure you use that resource. Also, virtual career fairs and professional online groups are super helpful to also develop your skills as well as you go through the process. Some of the professional organizations to consider on the right side include American Public Health Association, Society for Public Health Education, Society for Behavioral Medicine, and Academic Health. And there are many, many other organizations that you might be interested in, but these are just some organizations that we were thinking about while creating this presentation.
Hi, I'm Peyton Matthews. I'm also a graduate from Fairfield U with my bachelor's in public health, and I recently just graduated from the London School of Hygiene and Tropical Medicine with my MSc in public health and a concentration in healthcare management. I'm actually still in London right now, so it's 7 p.m. for me here, but I would not miss this for the world. So online courses for continued learning. We're going to go through webinars and different online courses. You have the APHA webinars. We have Delta Omega webinars, CDC. You have your local public health chapters that might be individualized to your university, as well as the USC Center for Health Journalism. You have Public Health Communications Collaborative and the Frontiers free webinars. As well, for online courses for continued learning, you have LinkedIn Learning, which it can be free if you have institutional access or if you do pay for premium. Statistical Horizons, it's free courses on statistics, such as you can refresh your memory on SPSS or R or Stata. You have Coursera, which is free for the course to take itself, but if you wanted to, you could pay for the online certificate, which also looks really great to future employers. You also have Class Central, which is similar to Coursera, which is free also for the course, and then you would pay for the webinars. Or if you wanted to obtain your online MPH, Fairfield U actually has their own Master's in Public Health program. as well as the London School of Hygiene and Tropical Medicine. They have a distance learning program if you wanted to do that in the States. Johns Hopkins, UNC, and then a lot of other big universities.
Hi everyone, I'm Philomena Apia. I recently graduated at Fairfield University as well with my Bachelor's of Science in Public Health. I currently work as a project director coordinator for Fairfield Cares Coalition. So I'm gonna talk about just how to present your skills as somebody who just, got out of the job search process and navigated, recently graduated and trying to figure out how am I going to translate my skills that I have or don't have, and how do I sell myself when I go to interviews or just in the whole job search process. And these are just a few of the things that I learned along the way. So just, one of the most important things is highlight the unique skills that you have, from your degree, whether it's language skills, statistical skills, or computer platforms that you know. So if throughout your degree, you learned Stata, you learned SPSS, try to highlight that on your resume. Depending on what job you're applying to, an employer will see that, and, even though you might not have a master's degree, they will see that you have some foundational level that you could build upon. So don't let your lack of skills, deter you from applying. One of the biggest thing I told myself is, it doesn't matter what sometimes it doesn't matter what they're requiring for, is how you sell yourself and show that you have other skills to match what they're looking for. And also you can sell your soft skills, your emotional intelligence, teamwork, professionalism, your adaptability and willingness to feedback and critical and hard work. You can also show that on paper. So just be willing to go beyond what they're looking for and showcase, what you come with besides just what the specifics they're looking for, and focus on highlighting all the things that are relevant. So for me, one of the biggest things was, I recently graduated and most of the job postings were requiring masters, and I just finished my bachelor's of science, and that was a big deterrent for me because I was worried about, I don't qualify for them, but, making sure you highlight the relevant skills courseworks that I took, whether it's biostats, whether it's epidemiology and things like that, to show that while I don't have the master's certifications, I do have a level of understanding where, I could build upon that, and I'm very willing to learn. So just be able to showcase yourself in that manner, and, they can see the passion that you come with. Also be able to distinguish yourself with the opportunities and experiences you have. No experience is bad, whether it's volunteers, other jobs you've had, capstone presentations, participating in a team. Just find a way to put that and package it in a manner that, looks presentable and, speaks to your skills. Also find strong references to reinforce, what you are sharing. Whether it's a professor, whether it's a previous job you've had, just find somebody who speaks to your character and just your work ethic to show that, while you may not have the immediate experiences they're looking for, you're somebody who's a go-getter and willing to, get your foot in the door and just get running. So just don't let your lack of skills or lack of degree requirement deter you from applying. Just apply.
Great. So now we want to talk a little bit about ways to get involved. And so given everything that's happening in our nation and our world, advocacy opportunities are really needed right now, especially public health involvement in whether it's local or national advocacy work is really, really relevant and timely. And so we're going to highlight a couple ways that you can do this if you're so inclined, both, overall and then more granular ways to do this in your local community. So I'm going to start out with Human Impact Partners. Human Impact Partners are a wonderful organization. They have a lot of great work, including an advocacy set of resources, evidence-based resources and tools that you can find on their website linked here. And we will share a list of these tools with you at the end through the listserv as well. They have a listserv that I've been following for many years now called Public Health Awakened. And I really encourage you to check it out. The goal of the listserv is to organize for health, equity, and justice, which is very relevant right now in our field. And when you sign up, you'll get a myriad, an abundance of emails that come through. Some of them are job opportunities, some of them are advocacy opportunities, social movements, national movements, news articles, evidence-based research that's released, things that are timely and topical. And it can be a wonderful way to learn what's going on in your area, in your field of interest, or to network with others doing work that is interesting to you. The Society for Public Health Education also has a set of advocacy tools and resources. They're, situated in Washington, D.C. And so by proximity, a lot of this work is very relevant and local to them, but you can get involved either in the national chapter work through their resources, or a lot of SOFI chapters also occur on a regional or state level as well. So you may want to look into that. If you are interested in health policy and you want to leverage your experiences, your insight, your expertise to contribute to policy or legislative testimony, you can always, no matter what your role is, email your representatives, either your local representative, state, and beyond. If you've never done this before and you're nervous, what should you say? What can you do? There's online tools that are available to help support you in this process. So commoncause.org is one such site where you can find out who your local representatives are. You can find out sample scripts to include in your emails or your voicemails to talk about causes that are meaningful and important to you and any public health professional during this time. Right now, the American Civil Liberties Union, or ACLU, has also been very, very active on their website. They have tons of ways to get involved personally, professionally. You can also see we've listed here the Network for Public Health Law, which has a bunch of topical resources on fighting for public health and public health issues that you may be passionate about. If you're more interested in getting involved on a community level, there's local organizations right now, agencies in every state, in every community doing critically important work. Some of this work, especially now, is underfunded or understaffed, under-resourced. So I'm sure that there's a nonprofit food bank, school, or health department that would be willing to take a volunteer, would be willing to take an intern, would be willing to get some of your expertise and some of your support if you reach out. There's also national organizations with local chapters. So the American Public Health Association has its national chapter, of course, but there's state affiliates. Most states have a regional chapter. You can get connected, and a lot of those groups are doing work that's more specific to your regional location, ways to get involved and network more locally, community building and advocacy opportunities locally. If you're interested in a certain topical area, and it was hard to list them all, but let's say you're interested in mental health, for example, the National Alliance on Mental Illness has state and regional chapters that are always looking for volunteers. So any way that you can get involved, that you can demonstrate your passion, that you can get a foot in the door is not just helpful for your career, but also really imperative for our field, especially at a time right now. There's area health education centers, or AHEC, that are located regionally across the U.S. And then there's a lot of other groups. Some of these are even paid opportunities and provide stipend or tuition assistance, like AmeriCorps Prevention Corps and other related organizations, Peace Corps, etc., that do really important public health work and rely on a community of students and young professionals to engage in this critical community building and advocacy work, whether it's regionally, locally, or nationally abroad. Okay, I'm going to pass it back over to Georgi to talk about job searching.
Sure, thank you. So when it comes to job searching in public health, it's important to know where to look based on your area of interest. And this slide breaks it down by focus area, giving you a head start on where to explore opportunities. So for example, for epidemiology opportunities, you have Emory University's Public Health Employment Connection, which is a free centralized platform developed by the Rollins School of Public Health to connect public health professionals with job opportunities worldwide. It allows employers to post job openings and enables job seekers to search and apply for positions in various public health fields. Through publichealthcareers.org, you can search for jobs by category, location, and job title and keywords. And also to help epidemiologists find or post jobs, American College of Epidemiology has provided links to sites that contain free job postings. Each site allows you to narrow your search to identify positions that best suit your qualifications and interests. For community service type of jobs, National Association of County and City Health Officials has created a tool to help you search for local health departments in your area. Also, Partner Finder is a collection of directories to help you find the community development and health organizations nearest to you. As far as biostatistics postings go, the American Statistical Association offers a job searching tool called the ASA Job Web, also known as the ASA Career Center. It's a specialized career platform for statisticians and data professionals. And last but not least, for health administration type of jobs, which I'm looking into, you can either leverage LinkedIn, Handshake, or American College of Healthcare Executives. On LinkedIn, you can search up the organizations, and they usually do pretty good job with posting up-to-date jobs on their LinkedIn page, and American College of Healthcare Executives webpage. You need to create your account, which is free, and then you can search through different type of positions based on qualifications you have. But the bottom line is that no matter your connection, your concentration, the key is to tap into both broad and specialized networks and keep your materials and profile updated along the way, because each and every type of job will require you to bring different types of skills or education to the table. So you really need to understand what each job posting is looking for, and then market yourself best way you can.
So this is going to be our little wrap up and moving forward on your public health journey. As you're beginning, or if you're continuing your journey in public health, remember that building a meaningful career, it's not just about checking the boxes. You need to be adaptable, intentional, and you need to stay true to your own values, especially in the time that we're in right now. And today's session, we went over the skills, strategies, and resources that you can apply to help you on your path in public health. So first, we're going to go over like networking. Just you want to really make sure you're building connections across the different levels, whether that's operational, personal, or strategic. You want to utilize both in-person and online spaces to form authentic relationships. And remember that networking is about quality, not quantity. So really make sure that you are building those meaningful relationships, because you never know when it might loop back around in the future. You really want to present your skills, as Philomena went over, highlight both your technical skills, just such as data analysis, your language proficiency, or different platforms that you've worked on, as well as your soft skills, just about like teamwork, kindness, professionalism, and adaptability. But let your experiences, whether that's internships, volunteering, or leadership roles that you had in your undergrad or that you are taking on now, really highlight those. Stay curious and keep learning. That's whether that's taking coming to like a Delta Omega webinar like today, or taking advantage of free trainings on LinkedIn or Coursera. Continuous learning keeps you competitive and opens new doors. Advocate for change. Get involved with advocacy efforts through platforms such as Public Health Awakened, ACLU, or Human Impact Partners. Small actions such as like emailing your local legislators or just giving a testimony can really make an impact. For example, I'm running the London Marathon in 3 weeks' time, which is really scary to say out loud, but I'm running for a Health Poverty Action. It's an international development organization that works to strengthen health systems and tackle the root cause of poor health in some of the world's most marginalized communities. And you really want to stay connected to your true values and engage with your community, whether it's through nonprofits and local nonprofits, as well as food banks, AmeriCorps, or the APHA state affiliates. There are countless ways to just get involved and build your experience while making a difference. You want to explore different career opportunities. So use job boards, like Georgie said, like Emory's Epi Jobs, Public Health Careers, and local health departments. Attend your career fairs when they have them at your university. They are a lot more beneficial than you might realize. Leverage your alumni networks and consider fellowships or even just short-term roles to get your foot in the door. You never know where they might lead. As well, just continuously lead with passion. Let your interests guide you. The public health field is very, very wide, and whether you're involved in or interested in policy or just health education, environmental health, your unique background and your perspective are really valuable, and they're needed in public health.
Just to build on what Peyton just said, we have a few recommendations. In terms of leading with passions, that should be one of your biggest driving forces, especially in the job search process. There are days where, it gets a bit discouraging. So speak generally about why you're passionate about public health and why you got into it, and let that motivate your actions and your search throughout your whole job search process. So just pinpoint what your main interests are, let those guide you to, the groups that you find, the mentors you find, the organizations that you research, and even the opportunities that you end up applying to. Because I find that you'll be really invested when it's something that you're really interested in. You put more time in it when it's something you care about. Present yourself as an asset to any team, bring not only your skills, but your enthusiasm throughout your interviews. It's not just them interviewing you, you're also interviewing them to make sure that, they're a great fit for you as well. So just, you are an asset as well, and don't let the thought of you need to present yourself to them, stop you from actually having a conversation with them and trying to see if they're even the best fit for you to begin with. And you are meant to be there. The most important thing about public health is very broad, and that's a very beautiful thing about it. There are many different avenues you can go with that. So, and the work is very important and critical, especially in the time that we're in. So just know that the field is needed and you are very much needed in it. And then one of the most important thing, if you don't remember any recommendation, is just focus on what you can, especially when it comes to the job search. Just focus on what you can do on your part, having a good resume, preparing for real interview, and then, having a great interview, because beyond that, it's up to the employer. There's a lot of factors that could lead to you getting a no. So don't focus on that. Just focus on what you can do on your end to make sure that however you showed up to the interview, you showed up the best person you can, and then it is out of your hands after that. But at the end of the day, you get out of there knowing you did the best you can and you had a great interview. So.
Thank you so much, and we welcome any questions that you may have if you want to put them in the Q&A now. And we would love to help you. And this is our appendix. So we're going to be sharing this because I saw that there's a question asking if these slides will be shared after. So we will be sharing this so that you will have all the additional resources and these links that you can click on. Thank you.
Did you all want to run the poll?
Sure.
Yeah. Okay. So we were going to find out where you all are in the employment status. So I just launched it just to get a little idea of who's with us today. Let us know what your status is. And pick the closest one you can if you're not quite exactly one of these. Okay, give it 10 more seconds. All right, ready to see? Okay, can y'all see that? All right, we had a really nice mix of current students getting out there in the workforce and folks that have been around for a while. So very nice.
This is great to see. Thank you so much, Allison, for the poll, and thank you so much for being here. I did notice a couple questions coming in through the Q&A. I'm going to start with this one, but we'll circle back to some of the others as well. So in terms of skills that we're seeing in high demand, and someone asked statistical software, GIS applications, additional certifications. What I'd say, and this is from a survey that we conducted with our stakeholders in our region to say, what are the skills that you're most looking for in students that are either prepared at the undergraduate or master's level? What are the skills that you're looking for in public health professionals for hiring? We actually saw emerge. Well, yes, there are certain niche skills that are really helpful if you're trying to work in a specific industry. That soft skills were way more valued than some of the technical skills. And so what employers were seeing is it's easy to teach on the job some of these additional things. It's easy to train you on the job, but the things that are harder to train, that are harder to teach, the teamwork, the adaptability, the flexibility, some of those other traits are a lot harder to learn on the job. And so if you're able to demonstrate to an employer that you have some of these soft skills, you have this emotional intelligence, you have this ability and willingness to learn, most employers, not all, but most employers are really willing to teach some more of those technical skills. Now, of course, it doesn't hurt, depending on the job you're applying to have certain skills and abilities. And so if you have some of those skills, certainly highlight them. Linguistic abilities, statistical abilities. There's some high demand careers right now. There's a shortage, at least in the New England area, of environmental health sanitarians. So having skills in that area, many employers will train you and get you certified on the job as long as you have willingness to learn. And so I think having that willingness and highlighting the soft skills may be really important. Is there anything, Peyton, Georgie, or Philomena, you want to add to that one?
I would just add that mostly when you're either doing your internship or when you're entering a job, it's all about learning while doing the job. So while you might have a foundation in SPSS or R or any other statistical software, the coursework might not cover everything, but you have a strong foundation that then you can build on. For me, I found that communication was the biggest skill I could bring to the table when I was doing my administrative internship. It's really important to just be detail oriented and not miss a key information that your preceptor or project manager is communicating to make sure that you're able to successfully complete the project. That's all I can add. But I'm also seeing other questions about like networking and I see this question, do you have any advice for networking when you cannot offer anything to others and sometimes they're might get ghosted? Don't think that you have to offer something to others, I would say. And especially when you have a good conversation with people, it's very important to follow up. And if and being ghosted doesn't mean that they don't want to have a conversation anymore. It's just more like they might not have a time. So I would say like follow up after like 4 or 5 days. That's a very um, not a big period to um, uh, follow up after having the conversation. But I will say, in terms of showcasing your skills during networking, especially soft skills, just make sure that you listen and not don't have just like a script of questions that you want to ask. Just make sure that whatever answers you're getting, build on them, be intentional and genuine when having conversations. And I think through these type of conversations, you'll be able to showcase your personality better than just being strictly professional. Make sure you also build personal relationships with people you're talking to and not just talking about the business.
Just to go off what Georgie said, I feel like one of the biggest thing is we're also focused on trying to ask for what we want, but be genuine and actually curious about, the conversation you're engaging in. Approach it with a genuine curiosity, ask questions about their experiences, their challenges in the role, any advice. It might be a director and it's a role that, you think, it's not something you're into right now, but the beautiful thing about public health is somebody always knows someone. So you actually showing genuine curiosity in their experiences and actually listen for their advice. They might, in the middle of the conversation, they might say, oh, I know a friend who's an epidemiologist. I'm going to connect you with her, if that's the track you're doing. So just don't let the fact that their role might not be, you think they're way high up for you, because as long as you keep them talking, people love to talk. Just have them talking about their experiences and what it is that they're doing in their role and what makes them passionate about what the positions they're in. And they can tell that, you're not here just because you want them to give you a referral or you want a recommendation. You actually coming to ask genuine questions because you want to get to know the person. So don't go into networking as, I'm getting out of this because I want a card with a business card. Sometimes you don't get a business card. A few of the networking events I went to, I never came out with a business card. But then I sent a follow-up email and I'm like, oh, remember that conversation we had about, and they're like, oh, wow, it was really amazing. I have a friend and then that's the connection. It might not be through the person you're immediately talking to, but you'll get a second connection somewhere. So.
Also, going off of that, when you want to, I saw the question on how do you highlight the soft skills you may have? You can highlight that in your resume by saying that you worked and you were very adaptable in your role, or you made sure that example for me, like when I worked in the hospital during COVID, I just talked about how I collaborated with other healthcare professionals and I really wanted to make sure that the patients felt comfortable. And I used my communication skills to make sure that they understand like what was going on. You just want to show that you are communicative, you are adaptable, and you work well in teams. And I think that is a big thing that a lot of employers are wanting is they want to see the skills, but they also want to make sure that you do fit their team and what they want. Because I would say like I'm working in a healthcare startup, and what I've realized is I just graduated with my master's in public health, and my healthcare startup is not just only public health based. It's works with all different wellness professionals. And what they really liked is that I highlighted on my CV and in my interview is that I was very adaptable and I worked in multiple different from being a sales associate to working in hospitals to being the public health club president. There's just different things that I've done and they really liked that I come from broad skill set and it wasn't just what they wanted on the job form.
Great. Yeah. You all said everything I was going to say. Just generally to express willingness to learn. I think they like to see people who are willing to learn and grow. None of us ever know everything. And so looking for opportunities to learn and learn more. It's perfectly acceptable to ask for an informational interview that you want to learn more about the organization. You want to learn more about the person, like Philomena said, see what they, can share with you. And then, many professionals are interested and willing to serve as mentors and provide mentorship. So if you approach it from that lens, you may also get some additional outreach. I see other questions. Maybe I can have some of my colleagues help me answer about tips for networking on LinkedIn and course recommendations in Coursera.
Some course recommendations I recommend I've actually taken myself is just global health and statistical analysis with R, which helped me with my public health degree. But statistical analysis with R for public health is from Imperial College. There's epidemiology and public health from Johns Hopkins. The Essentials of Global Health is free from Yale, but mainly anything that you think that you lack a little bit of skill set on, you can find it, whether that's healthcare policy, management, statistics, epidemiology, it will all be on there.
And thank you, Peyton, tips for networking on LinkedIn. I always encourage students to reach out to alumni in the network. If there's someone who's graduated from the same institution that you have that's doing a job in a field that you're interested in, they may be more likely to, respond to a request from someone they recognize within their academic network. But you can also have shared and mutual connections with other people. Georgie, Philomena, Peyton, anything to add about LinkedIn networking?
Kind of said what I was gonna say. Most of
Yeah.
my work through, if it is an organization I want, you can always find somebody from, your alumni connection. So I put, sometimes I put my school in it in the search of people and a list of people pop up. And then that's where I do that. Hello, I'm a fellow graduate from Fairfield University. And then, they might not know you, but the school might get you, oh, hello, so just don't. There's a lot of ways to go about it. The first way might just be using the school link. You did graduate and you're an alumni, try that version. So that might, if that's your first step into your connection, use it. That's what I've been using since I graduated. So you may not get a response, but some people do respond and it's, you might make a connection that way.
I also recommend just seeing what they've been posting or like what type of work they do. And when sending the connection, if it's possible, just send a small note that you saw this and you were interested in that, and that's why you want to connect. If you have a premium, you're able to, I think you have few email options that you can send bigger notes. But generally, making sure that you're not just sending a connection and you have a reason for connecting is important. And I see another question, is LinkedIn absolutely necessary to build your profile as a public health professional, or there are other platforms that work just as well when creating a personal portfolio? I personally haven't used other platforms. I find LinkedIn more straightforward, but I also think now Handshake is emerging in terms of like posting different type of videos, and you can also reach out to recruiters there because they typically post who's a hiring manager after job postings. Um, but I've mostly used LinkedIn and my career service center at my current program. I'm not sure if others have response to that.
Use Handshake besides LinkedIn. And then for the LinkedIn advice, I'll say participate in LinkedIn groups related to public health. So like I joined epidemiology and public health. If you search public health as a keyword, they'll give you a list of different public health groups. And sometimes within those groups, they put job postings. So that's most of the jobs I saved on my LinkedIn were through postings from groups that I follow. So that's also a recommendation so that you're not searching for organizations because there are many organizations there. So if you search keyword public health or just public health search and jobs, you find different groups and people in the field are posting jobs in your organization. So that could be a way to find opportunities.
Great. And I see a few other questions coming in about Dan, one of our alumnus. Welcome, Dan, asking about interest in careers in academia. Typically in academia, you have to have a doctoral degree, but not always. Sometimes a master's degree is sufficient. But if you're trying to enter from the master's degree route, having teaching experience, and that can be varied in how that looks, can be a great opportunity. Adjunct teaching, other teaching opportunities. Someone also asked about postmaster's certifications to get more qualified, depending on the area you're interested in. And I would just say, there are certain fields that are looking for something, right? If you're interested in nutrition education, maybe you want to have some classes in nutrition and dietetics. If you're interested in health policy and management, maybe you want to have some business classes. But I would say that once you have a master's degree, a lot of the training after that will probably be on the job or specific to that employer. And so working on focusing the skills you have or getting experiences, what they're going to really value is not just that you've learned it, but you've applied the skills that you've learned. So even if you can apply some of your skills in a volunteer internship setting, that might be a great way to highlight yourself to an employer. I'm trying to see which other questions I may have missed here. Any advice? Oh, go ahead.
Yeah, sorry. The advice that you wish you had gotten when you were applying for jobs. I recommend looking at the job advert and then really tailoring your resume to match what they're looking for. And then really highlight, I guess, what they're looking for in their qualifications in your cover letter and how that matches to your skill set and the experience that you have, because that will just make you stand out. Because now in the day of AI, we have seen that a lot of recruiters are also kind of using AI to help them and see whether you do check the boxes or not. It is a little bit disheartening to hear, but in reality, that is what's happening. So your resume and your cover letter is where you do want to show that you fit the perfect job description, and then you can really show who you are through that interview.
And I would just say don't give up. When you're applying for jobs, the right job opportunity will come about. It can be really hard to, feel that and say that when you're in the midst of the job search, and it can be really grueling and disheartening. But like Philomena said, not to take it personally, to put your best self forward, and to keep trying, because the right opportunity will arise. I'm seeing there's one more question we didn't get to: advice for those stuck in the overqualified and underqualified loop. And if I'm interpreting that correctly, what I take that to mean is, if you feel that you're not qualified for a position, that doesn't mean you can't still apply for that position. You can't try to sell yourself and your skills that you may have that may be applicable. So a lot of times they'll say, have 2 years of education or these skills. And so it's possible that even as a student, you've had a couple of years of experience because of internships, because of volunteer opportunities, because of other opportunities that really are 2 years of qualified work experience. So if you can diversify your experiences and you can portray them in that way, it's possible that you can apply to those jobs. You don't know who else is applying, that maybe you might be the right fit for a variety of reasons. And then if you're overqualified, that can be tough too. I think applying for a range of jobs, some that are reach jobs, some that maybe are more squarely fit, and some, that you're unsure about, might give you the best chances. I wouldn't be too picky when applying for jobs. If there's something that looks like it's vaguely a good fit, you might want to apply. The worst that can happen is they say no. The best that can happen is you get an interview or you learn a little more about yourself or the employer in the process.
I know sometimes you want to meet, the 100% requirement, and that was what I was doing in the beginning. I was trying to meet every single thing, and you don't meet it, and then I don't apply, but just you don't have to have the exact experience listed, like sometimes they hire based on your willingness to learn, not just experience. So you just have to, focus on selling yourself and your transferable skills, your academic experience, just like Dr. Ruwisch said, your personal projects, your capstone. Don't let the fear of not having every single requirement stop you from applying, because in my interview, sometimes my capstone project was all the conversation we had. Sometimes it's me being on RA. That was the conversation we had. Oftentimes it's not even about STATA or SPSS. It's about, oh, how was your experience as an RA? They want to talk to you and see how you connected with people. How did you connect with your residents? How were you detail oriented? How were your organization skills? They ask you things beyond this. I did SPSS and STATA, depending on what you're applying for, to see what kind of person you are. So you don't have to meet every checkbox. Just apply. You never know.
And I know we're running out of time. I see just one more question in the Q&A box that Georgi is typing an answer to, but while he's typing, I'll just say, if you're searching for an internship, whether you're an international student or you're a local student, I would definitely recommend the Public Health Awaken listserv. A lot of opportunities come through there. There's formal internships, like, there's big organizations like Save the Children that have, regional and international internships, and they have specific deadlines you have to be mindful of and apply for as part of a cohort, but there's lots of organizations that have informal internships. And so if you look for an organization, a nonprofit, an agency that's in your area, or maybe even is offering remote opportunities, it doesn't hurt to reach out to the executive director or somebody at that agency to say, these are the skills I have. I was wondering if you could use some help this summer. And you don't know who's going to get back to you. You may have to cast a broad net, but I do know that people have taken interns in that informal way as well. Anything else to add in the group?
I say use your campus resources. If you're still at undergrad or master's, use your university's career center, because I know they usually have an international student, department where they can help you through just the process of navigating, finding a search where you can meet your visa requirements and everything. So utilize your school and the resources they offer while you're there before you leave, because once you leave, the portal closes. So make use of it while you're there.
Great. And Georgi said something similar in his typed response. Thank you. These questions have been great. The engagement has been fantastic. It's been a real pleasure to speak with you all today. Anything else, Allison?
No, but thank you for joining us. So we'll send out slides if that's okay with the thank you with the presenters. And we hope that you will join us on our next webinar on April 22nd. You can find more details about that one and future sessions on our website. Just go to deltamega.org and look under Get Involved, and our whole professional development series is there. Well, thank you very much, and hope you all have a wonderful day.
Thank you, guys.
Bye-bye.
Goodbye.